The Lehigh Valley Hospital AIDS Activities Office is the largest provider of services to patients living with HIV in the region, and our region encompasses approximately 7 to 9 counties in eastern Pennsylvania, north of Philadelphia. We currently serve approximately 935 patients living with HIV infection, and that number continues to grow every year, both as new patients are being identified and as people are living longer and healthier with HIV.
When a patient is referred to our practice to establish care, one of the nurses will meet with this patient for an intake. During this intake process, the nurse will gather all the necessary information regarding the patient's medical history and also any psychosocial issues that the patient might be experiencing that might be affecting his health care or well-being. The team will get together and work on developing a process in order to find answers to help this patient.
We would do a great disservice to our patients if we just looked at them medically. We have to see them as the individuals that they are. We come from a trauma-informed care perspective so that we see and recognize patients as having had a great deal of difficulties in their process. The Lehigh Valley Hospital AIDS Activities Office provides patients with a one-stop shop where they can come in and have all of their needs met. Case management services, medical services, nutritional, behavioral health and supportive counseling, prevention services.
Because people are doing so well medically from an HIV standpoint, we now need to look at other aspects of their lives to help people thrive and do well. And I think that's really where the arts come in. And for many of our patients, these art classes have filled that role.
Our goal is to ensure that patients have all their needs met and hopefully find a safe place where they can come and just be themselves and not have to worry about what it is to be HIV positive.
As an ambulatory care pharmacist within the Lehigh Valley Hospital AIDS Activities Office, I have the ability to facilitate as a liaison between the physicians and the patients. So I have direct access to both the provider as well as the patient, and I have the time to hear patients' concerns, hear patient needs, and address them in a timely manner. My goal as a pharmacist within this clinical setting is to assure that all patients' medication needs are met and ultimately to improve medication adherence rates within our practice.
I think how we know that we're successful as a team in our collaboration is from feedback that we get from our own clients. But also, I mean, as a case manager, my job is to, constantly assess and evaluate, the goals that have been set in place and evaluate the treatment that's being done.
Over 2/3 of our patients are below the federal poverty level. Unfortunately, not a week goes by in the office that we don't have a patient come in who may be losing weight, and the simple reason is that they just don't have access to food. Without our food bank, many of these families just would be going without.
By providing our clients with food, Lehigh Valley Health Network's AIDS Activities Office allows our clients to supplement their existing food supplies, which are at a minimum right now, so they can have the proper nourishment.
The community garden started for a few reasons. We were looking for a team building activity, something that we can do together and have a product to show for it that would allow us to get outside of the work setting and contribute to something good. We also had a need at the time with our food bank to make sure that we had better, more nutritious choices to offer our patients, which is always one of the main struggles of any food bank. So this was perfect. One of our case managers thought, hey, this would be a great idea and a great way to both work together over the course of the summer and into the fall, yet also provide fresh fruits and vegetables for our food bank.
The people who make the garden grow, the volunteers, are all co-workers and go on a weekly basis. I think we all feel a sense of pride and accomplishment, and we all feel that we're giving back and making a difference in our patients' lives by going to the garden every week to work the garden and get these vegetables to the food bank so they can have access to this nutritious food.
Recognizing that optimizing health of any individual, including patients living with HIV today, takes more than just their physician and their medication. We've incorporated all of these different disciplines into our daily routine. We've really been able to truly coordinate and integrate those services to flow very smoothly through our patients' encounters so that they can access all of these services right in the same location, right at the same time, and get everything they need right in this one-stop shop.